Hi, I'm Amanda and this is Jenny. She's our airway nurse and I'm the airway doctor today. This is Vincent. He's a 30-year-old man with severe asthma. He's been in emergency for about an hour on maximal medical therapy and he's failing. So we've made the decision to intubate him. He has a difficult airway because he's become agitated and he's fighting his oxygen mask and pulling it off. To optimise pre-oxygenation prior to intubation, we need to settle him down, and we're going to do that with ketamine as a procedural sedation, essentially. Then we're going to allow for about 3 minutes of pre-oxygenation, and then we're going to move into intubation. Because this can sometimes deteriorate quickly, we're also going to be ready to tube immediately after the ketamine goes in. So we're going to set up our entire airway plan beforehand. Also, because he's severe asthmatic, we're going to need to assume his blood pressure might be dropping, so we're going to have some fluid ready, some aramine, and we're also going to be ready to decompress his chest after we establish the airway. And by that I mean physically compressing his chest. In terms of our airway plan, our A is going to be a video laryngoscope with a strength MAC blade, an introducer in our size 7.5 ETT, and suction obviously ready. Our plan B is going to be again the video laryngoscope, but also with airway additional movers, so burp, which our procedural nurse is going to help us out with. Our plan C is an LMA size 5, and our plan D is a surgical airway, and we'll prepare for that during the pre-oxygenation period by marking his neck as well. Jenny, can I ask you to get all our airway equipment ready?
Yep, got it all ready.
Great.
Ready to go.
Tim, can I ask you to get some fluids running?
Yep.
Some aramine prepared. For the ketamine sedation, we're going to need 1 milligram per kilogram and additional aliquots of 0.5 milligrams per kilogram. He's a 70 kilogram man, so we're going to start with 17 milligrams, pushed very slowly. Can you get that?
Yep.
And also succinylcholine. Thank you. We've now pre-oxygenated Vincent for 3 minutes, and his oxygenation is much better, and he's obviously quite settled. So we're going to move into intubating him. We've just had him on non-invasive. We've just changed him over to bag valve mask, and we have the apneic oxygenation on as well. Tim, I'm going to get you to push the sucker, and then we're going to lie him down. Okay? Good.
Sucks is in.
Great. Let's lie him down. Good. So Jenny, if I can get the MAC blade and the tube ready?
Yep,
Great.
ready to go.
Good. We're just going down the back of the tongue. I see some epiglottis. I'm looking up to the video and it's still a poor view. Okay, we're going to come back out and reassume our stance. So we're going to move to Airway Plan B. We're going to optimise his airway and also use some laryngeal manoeuvres. Jenny, if I can get your help putting a pillow just under him. Yep. Nice. Wait, 1, 2, 3. Great, good. And Tim, you can provide some laryngeal manoeuvres as well.
Yep.
And then we're going to start having another look again. Great. Thanks. Good, so good. Seeing a good video view. Grade 1 on the video. And we're passing between the chords. Can I get the stylet out? Stylet is out. Good, balloon up. Balloon is up. Good, and we're still in. Detach our band. You're okay. Okay. Touch. Good. And if you can listen on the chest, Tim. And we'll check our capnography.
Yeah. It's good air and trachea.
Good, we've established an airway. Okay, now we're going to move him onto the ventilator. So ventilating asthmatic, obviously we still haven't fixed sorry I won't keep him fighting. Obviously we haven't fixed the underlying problem. He still has a lot of air trapping and a lot of airway resistance, so we're going to ventilate him very slowly at 6 respiratory breaths a minute. We're also going to have a very prolonged expiratory time. If we're still having difficulty with airway pressure, we can also consider disconnecting the ventilator and manually decompressing the chest to reduce some of the air trapping, and then reconnecting him as well.